All right, well, first we're going to talk about what a sealant is. Sealant is excellent preventative care. It's probably one of the best ways to help seal the pits and fissures of the molars. So molars have these little dips and grooves where food can get stuck sometimes, mixed with the chemicals of your saliva and calcify in there. So it's hard to brush it out. So what a sealant does, it basically fills the little pits and fissures so that food doesn't get stuck in there and just kind of slides right off. Sealants do last a long time with good care. Here at our office, we offer a 2-year warranty. So every time children come, we check, make sure there's no chip or fracture. In case there was, we replace it at no cost. However, like I said, with good care, it can last many, many years. So we always tell our patients to try to prevent from chewing ice, limit their hard candy and chewy candy to help the sealant last longer. Like I said, it is preventative care. Some of the questions parents might ask is, a sealant 100% effective? Well, like I said, it is preventative care. It can chip or fracture, and that can mean that there can be a part of your tooth that's not protected. That's why we always check it to make sure that there's no voids, that there's no bubbles, and if there is, we fix it. Another question parents might have, does the sealant have BPA? We use Embrace, which is a moisture-resistant resin-based sealant, and it's BPA-free, releases fluoride. Another question parents and actually some of our patients might have, is it a long procedure? It's actually very, very easy. It's not invasive. It doesn't require numbing, and nothing goes in or around the gums. It actually takes just a couple of minutes per tooth, and because the sealant is light curable, you can eat and drink right after the sealant is done. We're going to go over our basic setup to do sealants. You're going to need your mouth mirror and explorer. You're going to need your isolation supply. You're going to need micro brushes, tool if you're going to be using prime and bond. You're going to need your sealant syringe, your etch syringe, a mouth prop, your proper suctions, air water syringe, of course a bib, and a mouth prop. You're also going to be needing a shield, if available, a shield for the patient's eyes, and a curing light with appropriate cover over it. Alright, so the first thing you want to do is obviously get your patient in the proper position in your chair. You want to lay them down so you're able to look into their mouth. You want to place their bib on so as you don't get them wet. Then you want to go ahead and place your mouth prop in, making sure that the patient is nice and comfortable. You want to go ahead and get your explorer, make sure there is no food debris inside the little pits and fissures. Okay, once you make sure you get all those big chunks out of there, get all that breakfast, lunch, and dinner, you want to go ahead and rinse your tooth with the suction right on the tooth, as so you're catching the water and you don't get it all over the patient's mouth. You want to dry it a little bit. You do want to keep your area nice and dry. Even though this sealant does allow a little bit of moisture, you do want to keep it dry. You use your isolation. This is a triangle. This will go on the cheek. You want to fold it a little bit so it's nice and comfortable on the patient's mouth. It'll stick to the cheek. If you're doing a lower sealant, you want to go ahead and get your cotton roll, put it between the patient's molar and the tongue, as so the tongue won't be licking the tooth. Alright, once you have everything nice and isolated, you're going to go ahead and grab your etchant. If you want to explain to the patient, you want to say, I'm going to be putting a little tooth gel on there. You put a little all over the grooves, filling it, make sure it's in there. You can also use your explorer to make sure it goes into the really deep pits of the molar, making sure that's nice and etched. You want to leave it on there for 30 seconds and then go ahead and rinse. Again, placing the suction right on the tooth so that you're catching the etch and the water. You don't get it all over the patient's mouth. You want to dry it a little bit. Once it's dry, this is Embrace.
The material we use for sealants is Embrace Wet Bond. With other sealant materials, you'll use your micro brush and a little bit of prime and bond and spread that through the grooves and pits of the teeth. Once you've applied the prime and bond, you blow air into the grooves of the teeth to help spread the prime and bond all the way into the grooves and fissures of the teeth. Once you've done your air dry, you would then apply your sealant material. Because we're using Embrace Wet Bond, you don't have to use any additional adhesive, no prime and bonds needed. Use your wet bond now. Squeeze a little bit of material all the way into each of the grooves of the teeth. Once you've got sealant material coating the entire occlusal surface and as well any lingual or buccal grooves, you want to seal those as well. You can use your Explorer and or a micro brush to spread the sealant material into all of the grooves of the teeth to get a nice even application without any bubbles or voids. Once you've spread the sealant material evenly without any bubbles or voids, the entire occlusal surface, buccal and lingual surfaces are covered. You'll use your light cure for 20 seconds. Once the sealant's been done, the tooth should look like this. Once you've light cured, go ahead and take your Explorer. You want to make sure that the entire surface of the tooth that's been sealed is smooth and has a glass or ice skating rink feel. So your Explorer should slide along the top of that tooth very, very easily, no catching on bubbles or voids. If you notice any bubbles or voids, you're going to go ahead, re-etch, dry, and add sealant to the area that has a bubble or void. After you've made sure it's nice and smooth, take a piece of floss. Between any two teeth that are touching near the sealant, you're going to make sure that there's no flash or overhang and that no sealant is stuck between two teeth so that the patient can floss regularly at home. Make sure you can floss well. Once you've done that, you're good and your patient's good to go. You'll have the doctor check your sealant. Your patient can eat and drink right away.